So the Vision HOVON-141 trial is our aim at defining time-defined treatment in relapsed refractory CLL setting for patients based on Ibrutinib and Venetoclax. And essentially we took inspiration from the CML disease and how the tyrosine kinase inhibitors were introduced and afterwards shown also could be stopped safely in patients who achieved a molecular remission. So what we did here was actually to follow patients based on MRD, minimal residual disease measurements, and for patients who achieved an undetectable MRD status in peripheral blood and bone marrow at cycle 15, they were randomized between continuing Ibrutinib monotherapy or observation. And for patients in the observation arm, we followed them every 3 months, tested whether they had still undetectable MRD, or if they became MRD detectable above 10 to minus third level, we would retest in a month, and if they increased above 10 to the second level, we would reinitiate treatment. Thus not considering the failure if a patient had to reinitiate treatment as long as we could prevent clinical progression. So essentially testing if we could have the time-defined treatment, but MRD-guided, follow the patients and make sure that we could safely capture any signs of subclinical progression and reinitiate treatment. And I believe the study was a great success. We had a 98% progression-free survival 1 year after stopping therapy. That's 27 months after initiating treatment for this patient population. We have predefined that it should just be above 75%. Obviously, we need longer follow-up to see what would be the real value of this, but I think this is the first step towards a practice-changing outcome in a clinical trial for how to define MRD-guided therapy and stop and start of therapy for CLL in a relapsed refractory setting.